topic is Wilson's disease, and it is a very important and disease for treatment, for diagnosis, and for exam purpose. So Wilson disease, it is a autosomal recessive disease. It is a autosomal recessive disease, and it is happen due to mutation in the 13 number chromosome, 13q, and mutation happen ATP7B. Okay, so it is a autosomal recessive disease, and mutation happen ATP7B. And why this disease happen? It is happen due to the defect in the copper excretion. So copper excretion happen by two process. Number one, copper excreted through bile and through urine. By these two process, copper mainly excreted. So most of the 90% copper excreted through bile, and rest of the 10% excreted by urine. Here in Wilson's disease, the copper excretion through urine is not defected. The defect happen in bile part. Okay, so there is a defect. So copper accumulated. That's why what happened? Copper accumulated and copper accumulated, so toxicity happen. Okay, toxicity happen, and that is called Wilson's disease. The result is Wilson's disease. Okay, so what are the clinical features? Clinical features. So copper accumulated in the liver, so the metabolism is defected. That's why what happen? Fatigue happen. Then there is seen hepatomegaly, and ultimate this hepatitis converted into cirrhosis happen. Okay, so second, there is the copper deposit in the brain. The copper deposited, and ultimate effect is what happen? The psychiatric problem happen. There is seen tremor and Parkinsonism like features. Can be seen. There is seen dystonia can be seen, and there is gait problem, gait abnormalities can be seen. So what are the neurological features? The copper deposited in the brain, and that's why tremor, Parkinsonism like features, dystonia, and gait abnormalities can be seen. Also copper accumulated in eye, where the copper accumulated in the Descemet's membrane. Descemet's membrane of cornea. Okay, Descemet's membrane of cornea, the copper is accumulated, and the ultimate result is what happened? There is seen a ring, and that is called Kayser-Fleischer ring, and that is called Kayser-Fleischer ring. Okay, so it is very important. In exam purpose. Kayser-Fleischer ring. Also the some endocrine problem also seen. And that is this 7. and the 8 is there is seen hypothyroidism. Hypothyroidism can be seen, and copper actually copper accumulated in all the body parts, so that's why all the parts will be affected, right? Like renal part, then joint pain, then in gynecological case, gynecological case, the bone marrow problem also seen. So those are those all the clinical features seen, but these are the main clinical features. Sometimes patient remain asymptomatic. Okay, sometimes patient remain also asymptomatic. And then investigation. So for first number on serum ceruloplasmin. Serum ceruloplasmin naturally decreases. In Wilson disease, the serum ceruloplasmin level decreases, and urinary copper. So copper cannot excreted through bile. That's why the urinary copper excretion will be high. Okay, and number 3 is hepatic tissue copper. Tissue copper. It is a gold standard. Gold standard test. So hepatic tissue copper is a gold standard test. Okay, and then also histopathology can be done. Histopathology can be done. 5 the radiological, like MRI. In MRI, in T2 there is hyper intensity seen. Hyper intensity can be seen. Okay, so investigation done. Serum ceruloplasmin, then urinary copper increases, and hepatic tissue copper, the gold standard, then histopathology and MRI all can be done. And last point is treatment. In treatment part, we can give this patient D-penicillamine, drug of choice. D-penicillamine, it is a chelating agent. D-penicillamine can be given. Also along with D-penicillamine, the pyridoxine can be given. Okay, pyridoxine can be given. Also zinc can be given, and zinc given in pregnant patient, zinc given. So this is the treatment and other symptomatic treatment. So this is a very important topic. Wilson's disease. It is an autosomal recessive disease. Mutation happen in ATP7B. This ATP7B is located on chromosome number 13q, and here the defect is copper excretion. Copper mainly excreted through bile and urine. The defect is here in bile, so copper accumulated and toxicity happen. In clinical features, the fatigue and hepatomegaly, ultimate cirrhosis happen. In brain, neurological features, tremor, Parkinsonism, dystonia, gait abnormalities, and eye, Descemet's membrane. In Descemet's membrane, the copper is accumulated, and there is Keisser-Fleischer ring, and endocrine hypothyroidism. Other also body part also affected. And investigation, serum ceruloplasmin decreases, and urinary copper increases, and hepatic tissue copper is a gold standard investigation. And histopathology, MRI. Also we can done LFT, liver function test. The liver function test is altered. And treatment, drug of choice is D-penicillamine. Along with D-penicillamine, we can give pyridoxine in zinc tablet given, and zinc tablet is given to the pregnant patient.